you're starting down a Botox regimen, is it something that you have to keep doing because you started it, or how does that whole mechanism work for Botox?
The way that I look at it is that you don't ever have to keep doing it. It's not like you'll get worse. So I always say when we use a neuromodulator, we now have five. Botox was the first, Dysport was the second, then Xeomin, Jeuveau, and now we have Daxxify. So we have five products and more coming. They're all in the same class of drug. They're all botulinum toxin type A. But they're not toxins. They're actually purified proteins and they're FDA-approved drugs. And I actually think that they're the safest drugs known to mankind. We know down to the molecule how they work. We put them where they want. We know how long it's going to take to work, how long it's going to take to wear off, within a few weeks for most people. And it stays where we put it for the most part. So these are drugs that when used as prescribed, work really well. Most of them are also used medically in much higher doses in people who have other illnesses. So there's a whole other list of side effects that go with that. But used for aesthetic purposes, I consider this as low risk as you can get. To always tell my patients, if you hate it, it'll wear off. If you love it, we can always do it again. But but what it does is I tell my patients it helps stop your aging or slow it down from that moment. Once it wears off, then you start again. It doesn't make it worse than it would have been, except for one place, and that's the forehead. The problem with using it in the forehead, which is something I talk about a lot,
Yeah.
is that the forehead lift, as I mentioned at the start of this, is a function. It's not an expression. So if you block that movement entirely, one is I think it looks inauthentic and makes you look older, and it drops the brows because the forehead is the only elevator of the brows. So if you block that movement, your brain is still trying to make it, but it can't. So these are big muscles. Some people have two muscles, some people have one that goes all the way across. So depending, if you have lines that go all the way across, then you have one big muscle. If you have a space in the middle and no lines, then you have two muscles and nothing in the middle. So depending on how you do it, if you don't knock out the whole thing, your brain is still trying to lift. Any part of the muscle left is now going to activate and you're going to have weird lines. If
Okay.
you knock it all out and you can't move, your brain is still trying to do it. So as soon as it wears off, it's going to be worse because your brain has been trying to open your eyes that way for the longest time, unless you can learn to lift your ears, like I said. So I tend to, as women get older, do less to nothing in the forehead because
Okay.
I don't want to drop the brows. If you go in the middle between the eyes,
Yeah.
those muscles are pulling in and down. So you can get a nice lift.